How many mothers have lost their children because of the state of our healthcare system? How many people can't get access to a bed because of the state of our healthcare system? How many Jamaicans can't access a bed, medication, surgeries, KPH unattended? Cornwall Regional in crisis. And the words of Christopherton is telling you and I, Jamaica. Many Jamaicans can't get access to a surgery because operating theaters. But tonight, Jamaica, I want Christopherton to hear the story of another mother. Because according to Christopherton, there is no crisis in healthcare. That is his words, Jamaica. There is no crisis in healthcare. Tonight, I'm going to carry a mother, Jamaica, for the next half hour. I'm going to carry a mother, and you're going to listen tonight, Jamaica, as the mother tells Jamaica what happened to her 16-year-old son at the University West Indies, University Hospital of the West Indies. Producer, can you let the mother join me tonight? I want Jamaica to hear. Good night, Mommy. Can you turn on your camera, please?
Hi, Andre. Thanks.
Good night, Miss Kenisha.
Yeah.
You called me last week asking me for an attorney.
Yes.
But can you tell Jamaica tonight what happened with your son?
Okay. So let me start from in 2022. He came home. He was home complaining of like a pimple on his left knee. He plays
Yes.
football.
Mm-hmm.
So of course, he's touching it, saying it's, irritating him. I told him, don't touch it because he may get, infected.
Mm-hmm.
I initially took him to the doctor when he started having difficulty walking. And the doctor said to me he could give him an injection or the pills. So I said to him, I know the injections will work quicker as an antibiotic. He was more sympathetic to my son, who said he was afraid of needles. So he prescribed some pills, antibiotic pills for us, and said to come back within 2 days, which was a
Mm-hmm.
Wednesday.
Yes.
When we went back the Friday, his knee was badly swollen. I had to lift him up.
Mm-hmm.
The doctor then called an ambulance and we went to KPH. So it was KPH first. We got there at 2:30.
Yes.
However, we went through the emergency section and he was admitted at 8 o'clock. So we're there for hours before he was told you're gonna admit him.
Mm-hmm.
Um, when we got to the ward, yes, the surgical team was right. They came right away and they did the treatment. I guess all the needles he could get that night. The first doctor that addressed him, I think, was still in training because he did not know where to put the needle. He put the
Wow.
needle on the wrong side of the foot, and he was aggressive. I guess I saying if you can be sympathetic or empathetic when you're doing the treatment. So the other doctor came as a resident, told him it was the wrong area. He did that. Anyway, he did a surgery the early Saturday morning because it was
Mm-hmm.
a Friday. So he did surgery Saturday morning, and they said it a washout. He had to
Yes.
go back to Tuesday because they said it wasn't done properly, or there's more, pus there, stuff like that. So we did that, and while he was going through the treatment, there was some stuff that happened that if I wasn't monitoring him, maybe he would have lost his leg from that time.
Wow.
Because at one point he started telling me that he was itching. I thought it was mosquitoes because he said the mosquitoes were big. I found out that they changed his antibiotic because I was basically monitoring him. I was there every day. And I said to the nurse, he's having a reaction to the antibiotic. And she said, no, everybody has to get that. So I said, no. She was referring to the blood thinner, the heparin. So I told her, no, he just got a new antibiotic and his skin, he's dark skin, and you can see the rashes on him and stuff like that. So I told her to talk to the doctor about it, and I'd rather they change it. She did not talk to the doctor. I wasn't aware at the time, and then I realized a couple of days later he started to drain again. So when the
Wow.
doctor saw that, he was like, "Oh my, he's getting osteomyelitis. He's going to have to drill the bone, stuff like that."
Mm-hmm.
So the consultant wasn't there. I'm gonna say something, Andre. I don't know if the whatever. What I noticed there were young doctors. A lot of stuff that they were doing, they were taking pictures and sending it to their boss.
So you think they
Well,
were experimenting or they were in
well,
strict? Mm.
Well, here's the thing. The team was available for you to speak to, but the consultant, I don't know how busy he was or what was happening. He wasn't there all the time. So their method of communicating with him was via WhatsApp or
Yes.
phone calls. So a lot of that was happening. And he would guide them from there. There are times when he come in and he will talk to me, very courteous and everything like that. So I appreciated that. They were always available for you to talk to them. But after the second surgery, I said to him, Doc, um, could you brace his knee for him because when you do surgery, don't have that strength anymore. And he looked at it and he thought about it for a bit, and then he's like, he'll be fine.
Yes. Mm-hmm.
Turned out that wasn't the case. His knee started to deform. So had he braced it, he would have had that deformity. So when he's walking, he started to deform. When I took him back to the clinic, I didn't get to see the consultant. I spoke to the resident. He said to me he's not doing anything about it. I said, why? He didn't give me a response. I went back on another clinic visit. He said the same thing. He
Yes.
said when he become a man, he can break the leg and put a metal plating in it. So I
Wow.
said, why would you want to do that if he's young and it can be corrected? No. I went to the office. One of the admin there tried to call the consultant. He
Mhm.
answered the phone. We don't know what happened. After a while, the communication went off,
Yes.
and that was it. So when I took him back to this next clinic visit, I said to him, Doc, something is really wrong. He didn't come in with his foot deformed like this. What you're going to do? He looked at it. He did say to me he was very tired because he has not gotten any rest from June. And this was in December 2022. And he's
Wow.
been working basically every day. So I did say to him, I said, yes, doc, you're very tired. He said, yes, and there are over 200 patients in the clinic that day, and they were short staffed, probably about two or
Mm-hmm.
three doctors working. So
Yes.
he sent for an x-ray, and I did it.
Mm-hmm.
And then I took that result to his other doctor,
Mm-hmm.
and that doctor referred me to a specialist. He's a well-known sports specialist. So when I took him there, he looked at the x-ray and he said to me, yes, they did a pretty good job in terms of treating the infection. However, based on the type of deformity, my son's foot cannot stay like that because he's now having a what you call a bow leg, and
Mm.
it's gonna get worse. And because it's unbalanced, he's trying to like lean, his body is walking like lean to the right. And I was concerned about scoliosis or effects on his spine, stuff like that. And he was kind of walking with like a kick, him walking and kicking. So
Yes.
he said to me, he's not doing those surgeries anymore, but however, UWI has a team of doctors
Mm-hmm.
that specializes in this. So this was in 2023 January.
Yes.
So we got a referral to UWI, and that is how we started the journey there. When I went to you, the same junior doctor from KPH was there, and he said to me, "What are you doing here?" I said to
Mm-hmm.
him, "You will soon find out."
Oh.
So when we went into orthopedic and he looked at the x-ray result, he was like, oh, he knows sees what I'm talking about. But it's a different team of orthopedic surgeon persons who look at it.
Mm-hmm.
So we went to a section of the clinic they call the Elizarov, right?
Mm-hmm. Mm-hmm.
And they assessed him, we spoke about it. They said they were going to do surgery of the tibia. The consultant surgeon was concerned that there may be like dead bones, but he said he didn't want to go back in the knee. So we did a series of ultrasounds to see what happened. The first surgery was supposed to be in August 2023, Andre, but it was put off because they said they did not have access to some of the machinery that they were to use for this surgery.
Oh Lord.
Right. So I think in 2024, I got a call like the Thursday, and the doctor was saying to me, bring your child to the hospital for admission. So I
Mm-hmm.
was like, just like that, you didn't give me any notice and stuff like that. I was having some challenges with the surgical company. I don't know if I should call the name. The supplies, orthopedic stuff.
Ball out
So,
everything, lady. Ball out your pitney dead. Ball
mm,
out.
okay. So we got a prescription from them to go to Surgix to order some items. When I I checked in with them. I asked them if they took accept health cards, health insurance. They said no, they don't.
Mm-hmm.
No, the cost of the items were $252,000.
Mm-hmm.
I even called the Montego Bay office to find out, if it's the same thing, and they said they don't accept insurance. So I said, "How long have you been busy? Are you new?" They said no, about 6 years. So I went to the insurance company for my son and I said, what reassurance can you give me to say that this is going to be paid for because they don't want to take insurance? This is separate from the UA bill, which at the time was 284,000 something, right?
Yes.
And they said I would have to pay it up front and then take it from there. A cousin of mine said to me, as we're discussing, I said, maybe because the insurance companies are not paying the money on time, these companies don't want to accept the health insurance. So she referred me to the Ministry of Health and said, go in and talk to them and find out who,
Yes.
oversees these incidents. And I went there and I spoke. Well, initially I wrote the email. Sorry, I think the email was the 7th of November.
Mm-hmm.
And then I got a call in December and they said the email came to the wrong team, but they're going to forward it to the correct team.
Yes.
Initially, I don't hear anything from them. And
Mm-hmm.
um, I think this was November 2023. So about April 2024, I went to the ministry.
Yes.
They can't find the email. The email disappeared. I was like,
Disappear.
"What?"
The email disappear.
Yes. So when I
Mm-mm.
spoke to the young lady there, she said to me, I was to write over the letter, change the
Yes.
date,
Mm-hmm.
as if I'm just as coming to them. So I said, no, I'm not reporting anybody. The original date stands.
Yes.
So she said, okay. She gave me some instruction what to do, get documents from in school, stuff like that. I said to her, remember, I have insurance. She said, don't worry about that. We're just doing what we. So initially, no, they sent me with an invoice to go to Surgics. When I went to
Mm-hmm.
Surgics, no, Surgics changed them tune. Oh, yes, they do accept insurance. They don't
Sure.
swipe the card. So I said, I
Oh.
didn't expect you to swipe the card for that amount. I expect you to do a pre-authorization.
Mm-hmm.
So after all those up and down, I remembered this was October 8th, 2024. I sent information to Surgic. Surgic said they sent off the email the 9th of October. The
Yes.
insurance said that they will respond within 3 to 5 working days.
Mm-hmm.
25th of October, no response from Surgic. So call them, they don't get anything from the insurance, nothing like that. When I got in touch with the insurance, they sent me an email within 5 minutes to show that they responded to Surgic within 5 working days the
Mm-hmm.
amount that they would cover. And Surgics told me they did not get the email.
Email. Wow.
So I went back to ministry. Other stuff, no, my son file went missing. They can't find the
Mm-hmm.
file. And I'm, what is happening? So as an admin there took up the matter and
Yes.
they were telling me that if anything were to go back to KPH, my son was afraid of KPH because of the amount of cuts he got. And there were times the junior doctor was saying, cut go further, cutting. So he said, can't bother them cutting
So
for
they
them.
were
So he was
they
really,
were cutting up your baby like
yeah.
a lab rat.
So the amount of needles he got and the way how they handled him, he was so scared because a patient at KPH had told me that at one point he looked at the doctors and said, "Una the wickedest set of people about if you know wicked one more time." That is how he
Mm-mm.
was lashing out when he was there. So he was so traumatic, he did not want to go back there. So he said, "Mommy, I'm not going back there." So I said, "Okay, we'll continue with you." So ministry at the time said, "Okay, because of all this, they said to me, listen, we're going to take over this part for you. We're going to handle it, right?" So I was like, okay, thank you. Now, when we went back to the hospital in December, they sent me for another x-ray because the
Yes.
doctor said, come March, he's going to do the surgery because he's a
Surgery.
priority patient.
Mm-hmm.
We're so, okay. We discussed it. He's a sickler, but he's on the milder side. He has HBSC. So he's not someone who gets sick often. He's monitored by the sickle cell unit.
Oh
And
Lord.
his
So
last visit,
he has sickle cell.
he has sickle cell.
Oh my Lord.
So his last visit was in I think it was January 2024. So
Mm-hmm.
they had given me some tests to do, and of course he normally goes like every 6 months for checkup base, because he's in good shape, so to speak. He's one of the very healthy, and the result came back that everything was okay. His blood count was 11, which is good. No, the doctors, we spoke to them about that, and they knew that he had sickle cell, and thinking that they're monitoring based on it. I said to them, any concerns at all, you can reach out to the sickle cell unit. And if you
Yes.
want any information, I can go there as well because I'm that type of person. I'm not afraid to run up and down and get the information for him
Mm-hmm.
because I want it to be better. No, they said to me, of course, they kept asking if I made the payment, stuff like that for the, I said, yes, that's taken care of. And they said, okay, I need to bring proof because that has to be shown before he's admitted, stuff like that. He did
Yes.
another set of blood tests and they told me that we were to get some blood donated, at least a pint of blood or something
Mm-hmm.
like that, a unit of blood they needed, just in case. He did say that the procedure that he was doing would be minimal blood loss, but just in the event. So I said, sickle cell, of course, you need blood to help you for oxygen.
Yes.
And we went in the Monday, the 10th of March. And I said all along we were discussing the tibia. That's a little bit below the knee here, right there, because he said he's not going back into the knee. No, we got there about 9:30 thereabout, and I had someone to donate the blood because I brought someone before and it didn't work out, so I took my nephew there. We did
Yes.
not get any bed until 11 minutes after 8 that day.
Mm-hmm.
So we were there all day sitting on chair waiting on a bed. They said they don't have any bed.
My God.
So we were there, we discussed stuff with the anesthesiologist, discussing, the risk associated and stuff like that. And
Yes.
she said to me, Dr. Sheppy, she said to me, we have no concern about him because he's very healthy. They're seeing his file, everything like that. So I was like,
Mhm.
okay. When I left the night, because I was tired and I had an accident some years ago, so I was starting to spasm. So when I
Wow.
hugged him the evening and I went home and they told me he's the first one to go into surgery the following day. I spoke to him just before they took him out. So he
Mm-hmm.
went into surgery at 7. Initially, I asked them how long the surgery was expected to take. They said 3 to 4 hours. If there's any difficulty, it will go like 6 hours, right?
Mm-hmm.
So he went into surgery after 7. I decided, okay, if anything, I would go there for visiting hours just to see him. They called me after and asked me if I got the name of that antibiotic he had gotten at KPH where he was showing a reaction to. So I made my way to KPH
Yes.
and spoke. I found the doctors there because, of course, I know who his team was. And every time I take him to a doctor, I try to find out at least one of the doctors' name. So I knew
Mm-hmm.
the team that handled him. So I found them and they were able to pull his file. And they said to me, they realized he was getting a particular medication that had stopped like within 2 days. So I said, that's the one because all the other medication he got, he didn't have any reaction to it. So when I
Yes.
spoke to Yui about it, they said they will not give him that one, right?
Mm-hmm.
No, while I was at KPH, I got a call from the consultant surgeon, and
Mm-hmm.
he said to me, "Mother, is like there's a situation now. Surgics." He was saying we ordered part of the items apart from the metal plates that were going into his foot because he was getting some rings. We ordered 10 cc cancerous chips, like a bone allograft. So he was saying something about 5. He received 5. So I said to him, no, it's 10 that we ordered. He said he knows, but only 5 Surgics sent. So I
What?
said, what? Yeah. So I said to him, why? He said, Surgics don't have any more. So I was like,
Mm-hmm.
okay, so it means that we need to try and source the remainder. So he said to me, no, we can't source that because I'm already in surgery. I started the surgery. So I now need to do a bone graft. And if I don't do the bone graft, your son will not heal.
What?
So I'm like, what's going on? So I was
So wait,
beside
wait,
the
wait,
doctor.
wait, 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 wait. So you're saying the doctor start the surgery and him don't have all of the item.
The package did not arrive until when they were in the surgery. That's what he's saying,
Mighty God.
So I had no choice, but so I said to him, I'm going to make my way to the hospital. He said he can't wait. I have to give him a verbal over the phone. So the doctor beside me at Cape it was saying, well, his bone is good, but I'm saying there's nothing I could do. So I said, go ahead. So I was there, I went home actually and I researched hip bone graft and it
Mm-hmm.
looked painful. And I'm like, oh my God, with this is an additional stress on his body being a sickler. So when I went up there, we're waiting, I was like, he's still in surgery, knockout surgery. About 5 o'clock, I got a call
Yes.
and they said to me, he's out surgery now. Mother, you can make your way to recovery. So I went by recovery and knocked the door and they told me I had to wait outside because they were busy. I was out there for a little over an hour. A nurse came out and said to me, they need a bottle of water. So I
Mm-hmm.
got one of, I think it's what they call a 1 liter, that tall water for him.
Yes.
And I
Mm-hmm.
gave it to her and they said, wait some more. Then they called me in and I was able to see and they told me to wash my hand. The first thing I saw Andre was his lips were white and swollen and his face looked big, some face swollen.
Wow.
So, but his eyes, he was open. I was like, why your face so? And he was like, my lip turn, him touching him lip. And then he was like, thirsty, thirsty, want water. So I looked at them and I said, where's the water I gave? Nobody answered. I had a bottle with some water in it, but I didn't want to give him because I said, I don't know, whatever. One of the doctors, I think it was a nurse or a doctor, one of them in there said, wet his lip with it. And
Mm.
he said, no, man, I want more, I want more. So she said, you're on
Your
fluid,
son dehydrated.
dehydrated. So he said, want more, want more. She said, no, you're on fluid. And he said, water, water. And I said to him, can you feel your foot? Him kind of thing. But each time he's talking, he was nodding in and out of consciousness. Him nod off, him come back, him nod off, him come back. A nurse came to him and said to him, how much pain between 0 to 10 are you feeling? And he said, 6. And then
Mm.
he nodded off again. And she said, okay, I'm going to give you some pain medication. When I looked at him, Andre, his chest was like this. He was doing like this. His chest was vibrating. So I said, I don't like how he looked. Why is his chest going on like that? And the lady, well, I don't know if it's a doctor or not, but I assume it's a doctor. She looked up at the machine and she said to me, he's okay because the monitor shows his heart rate is normal. One of the nurses was saying to me, oh, it's a warming machine. I said, which warming machine? She showed me something on the floor. I said, that's on the floor, not doing anything. Something is not right. He's breathing.
Yes.
And he was there and then he looked at me because his voice, I guess because he was still under anesthesia. And he was like, love you. And I leaned forward and I said, I love you too. And then he said,
Mm.
love you. And he did like this. And those were the last words my son said to me. Right? No, I said to them, um, let me see the surgical area. And she said, okay, I'll show it, because he's sleeping. And I said, yes, because I didn't want him, his eyes to open. He would sit and panic. So when she showed it to me, he had a scar in the middle of his knee. So I was like, but the doctor said I'm not going in his knee. And there was a scar to the side of the knee. And then, of course, the one at the hip side. And then I noticed almost down to his ankle, the front of his, what you call it, shin area. There had a scar there. So I said, what happened? Why is that chop there? And a doctor turned to me. I know it's a doctor because he was on the orthopedic team. He
Yes.
said to me, his foot was deliberately broken because we're doing it for lengthening. So so that one foot don't shorter than the other. And I was like, okay. I stood
Mm.
there looking at my son and I said, Lord, please don't let those be the last words my son said. I just didn't like how he looked, Andre. And
Mm.
he was there. And then, of course, because I said he went back to sleep, after a while, I went home. Um, before I went to the ward. I was about to take the bag because I said, it will seem like you can come back to the ward tonight. One of the nurses said to me, no, mommy, him soon come up because recovery call and said him soon send him up. And that was not the truth. That was not so. That was a lie. I went home. It took me like an hour to get home. So about
Mhm.
an hour and a half, I got a call. And they said, Mommy, we just want to give you an update on your son. He's still in recovery and we're monitoring him. I
Yes.
said, thank you very much for that. Half an hour later, I got another call.
Mhm.
And she said, Mommy, this is Dr. So calling from UV Hospital. Just want to give you another update on your son. At this time, kind of flashed to my mind that maybe he's awake and they're sending him to the ward. Her words after that were like, Mother, when you do these surgical procedures, there are risks. Every energy left my body when she said that. And then
Mm.
she said to me, your son woke up confused, disillusioned, he didn't know where he was, and then he became unresponsive
Yes.
and his blood count. And she said to me, we underestimated the loss of blood. So I was like, what? And she said his blood count went to 4. No, he's coming
Mm.
from 10, 11,
The
went to
blood
4,
count went to 4.
went to 4 before you realize and she said he's losing blood, but they don't know where. And she said to me, he became unresponsive and they put a breathing tube in and put him back to sleep.
Wow.
So she said, how far away are you living? I said, Doc, what's happening? My son died. She said, no. She said, but he's very, very sick. He's like the 12th sickest person in the island. I was like, no,
Wow.
man. I said, he's dead. She said, no. I said, he's 50-50. She said, we don't use that word. How far away are you, mother? Because his heart can stop at any moment, but we'll do everything. to resuscitate him. Come to the hospital, but don't come alone. So I said, my pitney dead. That's what I said to her. And she was like, no. I got my brother to take me up there. She said they got him some blood and he improved. So, she didn't say how much he got. She said he got some blood and he improved. We went there. We got there 11:45. We
Yes.
met a doctor outside. I think he says Dr. Lee is his name.
Mm-hmm.
And he said to me, he's losing blood. They're trying to find where he's losing the blood. So they're going to do an ultrasound of the abdomen. And they just called the person over to do that. Like within a minute or so, he came, said that, oh, the ultrasound was negative. I'm like, that sound like him going nowhere. But, because everything going through your mind, they
My
took
God.
me in and he said to me, we need blood for him. So you need to get relatives to go and donate blood. And when you donate the blood, bring the receipt to show us they gave blood. So my brother turned to him and said, what are you saying, doc? If we don't give blood, him not going to get any blood. No, no, we're not saying that. But currently we don't have any blood on supply. We're testing blood, but we can't find any match. And this is not our emergency surgery. This is a planned surgery. I
Mm-mm.
went in, and when I went in, the doctor said to me, mother, hold his hand, talk to him. He's likely to be hearing you, but he can't respond. And I'm looking at him and say, but is a dead penny this shit tell me if you talk to, because if you're gonna tell me say talk to him,
Yes.
him can't hear him, but So I said, when I spoke to the doctor, I said to her, I know I saw his chest as he was struggling to breathe, and you told me it was okay. And she said,
Yes.
yes, that was a sign of him struggling. But because the machine did not go off, they'd never take me serious. Come on, I'm a non-medical person. And I say to you, he's having some, like he's not breathing properly, and you're waiting for the machine to go off before you act.
No blood.
No blood. He wanted blood. He never got blood according to them until the following day.
My.
We left there about almost 2:30. When I got home, I got a call from a Dr. Fortune, who's an hematologist.
Mm.
And but before we left, one of the doctors said to me, the him being on the breathing tube is buying them time to find out what happened.
My
So when I
God.
got home, the hematologist called me and she started asking me questions about his health, his history. At the time, I said to her, I think his steady state was about 8.5, because that was the thing I had in my head. She said
Mm-hmm.
she had a reading before of him coming in with 11. So she said there's something wrong with going on with his kidneys. She said she's a part of the emergency team, and ICU called her to tell her they're asking her to please fix it because they don't know what happened.
My
No,
God.
what they told me is that he should be in the ICU. However, he's still in recovery because ICU had no bed space.
Mm.
So maybe he didn't have everything there, that you'd have in ICU. I don't know. So they have to be from ICU. Doctors have to be coming to recovery to do stuff and stuff. So she said to me, he needs blood. That's all she keeps saying, he needs blood.
Yes.
And the following day, his relative went to the blood bank to give blood. I got a call from someone from Renal telling me that he's going to need dialysis. I was like, oh,
Dialysis.
so I was like, oh God. But I'm thinking at the moment, I guess they're finding stuff so they can find things and correct it. So I was asking her if it's a one-time thing or permanent. She didn't answer. I said to her, we're at the blood bank, we just gave blood. And she said, okay, he got some blood and he stabilized. No, I was on my way to go there. I got a call about 20 minutes later from a Dr. Johnson who said to me, Mother, we have to take your child to the theater again. I said, what happened? He's swelling up. I said, swelling up where? Above the cervical area. So I said, is that the knee? He said, no. So I said to him, Doc, where? He mumbled, he didn't want to answer. So I said, Doc, don't play with me. Where? He said, the thigh groin area. So I said, I'm coming to the hospital. He said, he can't wait for me to come to the hospital. He need another verbal from me so he could do a procedure on my son and that will correct his issue. So I said, Doc, take care of my son. Please take care of my son. No, on my way to I kept getting calls and they said to me, when I come there, I was to come to ICU, come to the recovery area. When I got there, doctor stopped me telling me the consultant surgeon, which is Dr. Rose, wanted to see me. And so he didn't want me to go to the recovery section. So I said, why? And then I got a call, two female doctors. She said, where are you? I said, I'm here. They said, take a walk with me. I said, based on where they were, we had another section we could walk to go to recovery. So I went to that end. I realized that they didn't turn that way. They were going straight. So I said, what is going on? Mother, just walk with us, just walk with us. I said, tell me, what is it you have to tell me? Don't do that,
Yes.
because right now I realize it's not good news. She
Mm-hmm.
said, Doc is coming to talk to you. Did you come alone? I said, yes. So, but while we're getting there, I saw them going into a room, like a conference area. And I stopped at the door and said, did my son die? She said, Mother, we can't discuss your business here. I said, no, you tell me. You're going to bring me into a room to tell me the same thing I'm thinking no. And after I got a call from my sister who realized I was up there, and she made her way there, and I told her my sister was coming. I saw a doctor was walking and talking to another doctor, having a little discussion. We
Whoa.
went into the room, and they said to me I was to sit down. I said, I'm not sitting down. They said, Mother, sit down. I said, I don't want to sit down. Did my son die? Nobody want to answer. So I turned to Dr. Rose and I said, he's dead, isn't he? And he nodded his head and said, yes. My sister broke down, and honestly, it's like my heart stopped and come back. And I said to them, take her out of here, because she's going to break me down. And I looked at him, and I was like, you can't figure, you do a foot surgery. Yes, they're going to tell you there is associated. I said, my child is dead. And Dr. Rose looked at me. There were about 6 or 7 doctors in the room. And he
Whoa.
looked at me and he said, my surgery went according to plan.
Mm-hmm.
Everything, and he did his hand gestures, everything that I wanted to do was exactly how I wanted to do it. And then he did like this with palm, his 2 hands, and said, I handed a healthy child over to recovery ICU. So I was like, but you did give my child any blood during surgery, and that's crucial. A female doctor turned and said, he only lost about 800 ml, or just over a fifth of his blood. Being a sickle 100, that's too much blood for him,
Whoa.
right? So it is then now one of the I don't know if she's from ICU or recovery. She had on a hijab. She got up and she put her both hands on the desk, and she said, Mother, your child died suddenly. We don't know what happened, when it happened, how it happened. That makes sense?
Mighty God.
That don't make sense, right? And I asked to see him. Of course, late after we were there, we got a call from the registry.
Yes.
Miss Cox, because she said what the doctor said to me, it has to be investigated. A coroner's inquest is going to be needed. Police is going to be involved. The registry is going to call me and ask me if I want to bypass the autopsy.
The registry asking if you want to bypass
The
the
autopsy, and
uh,
let her just write up the burial order. So I
mighty
said to her,
God.
why would I want to do that if the hospital don't know what killed him? Oh, mother, I'm just asking. I'm just asking. So we went there the Thursday. My sister and I went there to say to her, I hope you guys are not thinking of doing an autopsy behind our back, right? And she said
Mm.
to me, no, we need your permission to do it. So we said, okay. And she said, we can't do it without your consent. She said, let's go for the file. She went to ICU for the file, and she said, yes. ICU told her it has to be investigated. So I will need to go by the station and get a police officer to come and officially identify his body. Then she said to me, hold on, let me confirm with the pathologist if the pathologist agree. And I'm like, okay.
My God.
She went there and she came back about 10 minutes later and said, yes, the pathologist says it's within my legal right to get to know what happened to my son. So we went by the Papin station, we gave her a statement. The police came to the hospital. When we got there, we
Mm.
handed her the receipt that, from the police station. She was like, autopsy is tomorrow morning at 8 o'clock. That's a Friday. So we said, no, no, no. You said you needed our permission. She started to go on. We don't need your permission for this. This is a government business. And she started going. So my sister got upset. I would knock the door. I would start to say, no, 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 you can't do that. And I said, and the pathologist would have to agree. And the pathologist will agree, because we said we wanted an independent person to sit in. If
Yes.
the pathologist don't agree, what we're going to do? Mr. I'm going to roll up here. Any other pathologist tell me, say, me can get an independent person. So the
Yes.
police officer said to me, he was calming down and he was like, Mommy, she's talking in medical terms. I don't know what medical term that she had talked about, but I guess he was trying to see that things look too bad. So we
Mm.
went to the pathologist, and she said she got the file Wednesday night to go ahead and do an autopsy as soon as possible. And she was saying the reason why they would do it quickly is because crucial information probably from the body. So I said to her, no, we haven't gotten anybody to sit in. I will need to get somebody independent, whether them fully independent or them I go work with, whatever it is, because me said this is Jamaica. We want to get somebody, on our
Yes.
side. So she put it off until the Monday. So the Dr. Rose called us now and he said to me, "Where are you?" At the point I said to him I was at the registry. So he was like, "Ooh, so you're not gonna bother do the autopsy?" So I was like, his voice perked up. So I said, "Let me, doc, I'm in the middle of something." And he said, "I'll call you back." So I said, "Okay." We did the autopsy the Monday, which is the 17th of March, and it came back inconclusive, cause of death pending. However, he had multiple organ failure, heart, liver, lungs, kidney, everything crashed.
My God.
And his spleen was, I think, not said twice the size. And I'm thinking, who nobody knew that. You're there and you did not see that the spleen was collecting the blood. And they told me they did an abdominal ultrasound that would have shown. And you didn't even need to do an ultrasound to see that his tummy was swelling up.
My.
And there was also blood on my son's brain, and he did not do a brain surgery.
Blood on your son's brain?
Blood on his brain. So when we put it to the pathologist, she was say like, it's not enough, she not enough to kill him, but she's still gonna examine it and stuff like that. So she has these samples now that she's doing. I thought it was at the government lab, but I understand you is doing everything. So here's the next interesting part, Andre. The following Wednesday, I went on the road. I didn't bring my phone because my brain wasn't there. So when I came back, I got a few missed calls. One of the number came back to Dr. Rose's private office. So I said, okay, he was calling me. Eventually, after he called me back and he said he was just checking up on me, he said, "How are you?" I said, "I'm not doing well." And he said he can understand because he has one child and he's a son, and every day I'm worried about his son. So anyway, I said to him, I have questions. So he said, "Talk to me. Let me see if I can answer." So I said to him, "Dr. Rose, did surgeons at any point communicate to the hospital that they only have 5cc cancerous chips?" Because Andre, if I order something and you, even if you had it at the time when I ordered, when you're packing the stuff, you
Mhm.
realize you don't have everything. You're supposed to reach out to me, not just the hospital.
Yes.
Nobody from surgeons reached out to me. So I'm asking him if surgeons had communicated to the hospital before. He started to repeat the question and then he switched and said, let me explain something to you. Bone from your body is the best bone to be used." So I said, "Yes, but we never planned for that." And that's not what I asked him. Him don't answer the question. And he was like, "No, no, 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 no. Remember, I asked you and you told me." So I said to him, "You called me while you're in surgery." He was like, "No, no, no. That is why doctors don't bend over backwards and help."
My
So
God.
I said, "Doctors don't say that. You're going to get me upset because I didn't go to you to beg anything." By the time the first money you will ask us 284,000 something. In December, the money went to 301,000. And on the day of admission, it was 335,625. And I asked them why I'm to pay 30 something thousand more. They said all the money I'm paying was estimated bill,
Mm.
right? So it kept going up, and you're telling me you're bending over backwards to help. I don't know how that come in. So I said to him, "Why are you calling me in the midst of surgery?" He said that's when the package arrived. He had already opened up my child, and if I had told him not to do the surgery, he could have stopped it. How could I tell you not to do the surgery?
My God.
And then the entire surgery would have been in vain, right? Because he thought it was two-part surgery. I don't know what two-part surgery is talking about. We only discussed the tibia. So he was like that. So I said to him, "You told me my child would not heal if he did not do the bone graft." And he said, "Madam, the answer to that is correct."
My God.
And then he went on, "Oh, the rings that your son got on his foot, they were free." So I said, "Doctor, I paid for my son frames." "No, no, no. Do you mean to tell me you think you paid for those rings? You did not pay one dime." So I said, "What ring have to do with my child? I didn't beg you with anything." The reason why he said that is because the pathologist told him I paid for the stuff, right? And those rings are given free. And by the way, you is not paying him. And in 2023, he did how much surgeries and he did not get any money. And he
What
went on to 23rd.
is what you said it, Dr. Rose said? You will what?
You are not paying him because according to he's volunteering his time. So it's what he's doing. That have nothing to do with my child. And the meme I volunteer for.
Wait. So the Dr. Rose said you will not paying him. So
Right, because he said he retired in 2010 and he did so much surgeries and he don't collect for them. So that was part of his conversation. And he was like, oh, you're blaming me. I'm to be blamed. And at one point he was like, he know what happened during surgery, but he will not have that discussion with me because I had formed my own opinion. The questions I am asking him, I should go and ask the anesthesiologist those questions.
So I'm inferring blame now on the anesthesiologist.
Yes, that's what he said.
Mighty God. So your baby suffered.
He did not get any blood. His surgery, when I got the provisional autopsy report, his surgery was 8 hours and 20 minutes, Andre. No blood.
8 hours?
8 hours and 20 minutes. So he developed a condition called rhabdomyolysis, which is serious because it's similar to persons who do strenuous activities, or you ever in a vehicle and you squeeze up and cramp, and when you come out you can't move. I now realize that that's a serious thing. So I encourage nobody to squeeze up in a no taxi or nothing like that. So because of his medical condition, and not only that, and whether or not you have sickle cell, but he's more high risk. So he was in surgery for so long in one position and probably not positioned properly. He developed that condition where now his muscle became weak and a toxin was released into his bloodstream. And that went straight to his kidney. And she said they found out that he was anemic within 2 hours of surgery. When I said to her, she said nobody could tell exactly when the anemia set in because it could have been from the conditions of the surgery, but that is when they found out. So Andre, he was not being monitored. You can't, as far as I'm concerned, all he was interested in was doing the surgery. Nobody took into consideration his health condition. It does seem like they had any discussion. They did not do a proper assessment of him to say the type of surgery that we want to do, his body can manage it. Remember, I take him to you. If he cannot do that type of surgery, let it be. We would have to work with the consequences if he had issues later on, because as I said, he could become, the bone rubbing can get infected later on, maybe it gets wider, affect him. However, if that was the case, it's something we'll have to work with if he can't do the surgery. So he was not properly assessed, and during the surgery, nobody was monitoring him. So when I went back to sickle cell unit to let them know what happened, and I was saying to the doctor, I said to her, somehow I think his blood count is like 8, stuff like. She said, no, mother, your son is a healthy sickler. He's always have 10 and 11. Even his result that he did in June 2024, his blood count is 11. Healthy child, and that's why they authorized the surgery, because they got his health information. However, because you're doing a surgery, even though he's under anesthesia, he's not feeling effects, his body is getting those struggles, those pressures on his body. Nobody monitored him. No blood in surgery, and when he came out of surgery, recovery, didn't have any blood either. So it's when his heart gave out,
Wow.
that is when they were now running up and down trying to get blood. Nobody had any standby blood for him. Right? What Dr. Johnson told me too is that the cut, one God Almighty cut in Andre from my son buttocks go down to him knee. What he said to me was that what they were looking for, they did not find it. So it was an unnecessary cut. Right? Them slice up my child, and he's gonna tell me what they were looking for, they don't find it. And that is when his heart gave up, because his heart could not take anymore. So according to him, it's a second surgery killed him. No, on the day of the autopsy, when I'm talking to the pathologist, she said the notes told her is same place on the bed in a recovery, then cut him. Dr. Johnson told me, saying, "Can I got theater?" And I said, "What? He was taken to theater?" She said, "No, they cut him same place on the bed, and they were trying to resuscitate him there." So two different information that.
Mother, so they tell you that they carry him to theater.
A second time.
And where did they operate on your child?
The pathologist said when for the second operation on the Wednesday, where they said they were going to do the thing on his leg, they're going to relieve pressure from it. It was done same place in recovery on the bed. He was not taken to any theater.
Mighty God.
Right. And I can tell you that I did an interview with our television station. And she said, "You will block them. You would tell them, so they will sue the reporter and they will sue the station. And the administrator of UE said she's not aware of the incident with my son. If I have an issue, I should file a claim against UE. The matter will go to court and it will be private between me and you. Me not understand no private between me and you, nothing. And I don't want to keep it private because you don't know who else this might happen to. And Andre, when I contacted Surgic said them send everything to UE. Them never shot on no cancerous chips. So when the rest of cancerous chips gone?
So you're saying that what the doctors are saying that the things them short.
It never
Surgery
shot.
confirmed.
Surgery said wasn't short. So I've since asked for information from them. Ministry of Health has reached out and said they want that information as well. So surgeons need to provide that because I said to them, up to now I haven't gotten full proof from them. But they said they sent everything, right? So I said I need to know who signed for it, confirm everything that was sent, and they said tomorrow, Monday, they'll be responding to that email.
Mighty God. And you
They
were
said
saying to the reporter that if they carry the news, what?
they will sue the reporter and they will sue the station. So the
Well,
reporter said she no bother bring the story because she's young and she don't want nobody sue her.
so the
So
reporter, the reporter never bother carry this story.
they never bother carry the story because you will bully her.
Mighty God.
So I went to the hospital to get a copy of his medical report, and every time I go there, this person have it, that person have it. When I went there, they told me that I would have gotten it last week. When I went last week, they said they won't have it because pathologist sent back for it. Then pathologist said them send it back to the records office. Record office said them don't have it. Pathologists have to now pull out their book to show that yes, it was sent to the records office. Then the record office is telling me, oh, is the lady from registry have it because she had to put some document in it. I don't know why every minute they are going to the file and this document this. And so all of us every minute, I don't know what they're doing. They're removing stuff, if they're adding stuff, what is happening. And up to now, we don't get the medical report. She said that she'll try and finish up. It was that Friday gone. I don't get a call. So I might have to go there tomorrow to find out what is happening. Every time you go there, somebody else have the file.
Don't be surprised that the file disappear.
Mm-hmm. Yeah.
So what is the present state of everything being
Well,
done?
we're waiting on the ministry is going to do an investigation because they said they're reaching out to the CEO. So we are waiting on Surgics to send off that information to them because I don't know if it's a runaround they were giving either. So I eventually had a meeting with one of their coordinators. I don't know why she wanted a meeting, just to provide the information because I brought my ID and everything to show that I'm what happened. We had the meeting and I spoke to someone there. I think it was Thursday or Wednesday, and she said that they said they'll send it off Monday coming. So I'm waiting on that. And they said to me, if I can get an attorney, I could do so as well because they're going to have a meeting with the CEO of the hospital.
So have you found an attorney?
Not as yet. I have been, checking stuff, but not as yet.
How long now you've been looking an attorney?
Basically the same week he died, even at the same time we're going to do the autopsy. I made some calls and to find out, some of them are saying that they're booked, or some person said they will call back. I haven't gotten a call back. So that's when I reached out to you and I said I wanted to see if, Mr. Buchanan was available, but I understand that he's no, yeah. Because at the same time, other doctors, they're upset because when I spoke to some of the doctors, he was like, so if I go to you, for my foot, me I go dead. And I was like, doctors, he said, yes. He said, no, how can you understand? Yes, surgeries, everybody know you're going to anesthesia, but nobody was looking to say you go there to correct a deformity, a low leg, and you end up losing your life.
So he
Then,
went in to correct a deformity on his leg,
right.
and your baby end up dead.
Dead because they were not prepared for him. No blood, because according to the doctor, the surgery is minimal blood loss. So basically, he was not paying attention to his medical condition. He was just paying attention to the surgery. So the surgery is doing minimal blood loss and not paying attention. So remember, the person he has in front of him is a very, very sensitive. Basically, sicklers, as what some persons say, them come like eggs. They are delicate.
Mighty God.
So he wasn't paying when I listen to everything, he wasn't paying attention to that, because if he was paying attention to that, he would have given him some blood during theater. And recovery, whoever would have him, would have given him blood after. No blood was there. They're now telling me his blood type is hard to get. If you are now saying his blood type is hard to get, why you plan the surgery? Why are you telling me that now? Which blood is crucial to him? He started to sickle all over. The pathologist says sickled all over his body. The stress of the surgery.
My God. My God.
And it's like I must not ask any question. And the Monday morning, I so forgot I never got the doctor name, but I know his face very well. When I saw him the Monday morning when we were going for the autopsy, I was like, Doc, good morning. The man touched me on my shoulder and just said, you'll be fine, and turned away. That's all he said.
Oh, what the doctor said?
Pat me on the shoulder and said, you'll be okay. That was his exact word. You'll be okay. And he walked away. He never even asked me how I was doing. He never even said condolence. He just pat me on the shoulder and said, you'll be okay. And he just walked right off.
My God.
One of the orthopedic doctors. Mhm.
How are
So,
you coping? How are you coping?
well, honestly, when it happened, when I heard, it's like I was in a daze for quite a while. Me, I wonder if me really, a little confused. It took me a while to soak in. Um, in the days following, of course, I'm like looking at him. I want to blame myself because he said to me initially, if we could put the surgery back to June, because this is his final year of school and he has exam coming up. So I said to him,
Oh, he
why?
wanted to do his CXCs first.
Right. And he was saying that if anything, no, he will sit out a year. Do I wanted, of course, to say he continued school. One of the factors that affected me is because as I was I'm home on medical leave from an injury. So I'm having some challenges with my work. So sometimes when I'm ready, them pay, when I'm ready, them drag them, the stuff like to frustrate you. And at one point they were threatening to basically cut everything, health card, everything. So I was worried that if I lost the health card, I wouldn't be able to take care of him because I know I have to do a lot of blood tests, I have to do x-rays and
My
stuff like that. And
God.
I'm a single parent. So I was pushing on the financial aspect of it. Yes, I didn't like how he walked, stuff like that. But I'm saying, boy, if we not get that do within a certain time, we're in problem. So and he said to me, persons are going to look at his foot weird. So I said, you're going to a school that they know you had an injury and you're trying to correct it. So if your friends laugh at you, then I guess they weren't good friends. If you start a new school with it, that is when persons probably look at you weird and stuff like that. So because I was pushing back on him, that kind of guilt. I went and spoke with his uncle, I spoke with other relatives, and I said to them, what you think about it? You don't want to do the surgery, maybe it's cosmetic part of it. And they too said they didn't like how he walked, they didn't like how he looked. And I said, he was like, how am I going to get to school? So I said, I've made arrangement for vehicle to take it to and from school. And then he said, okay. The doctor said when he spoke to him and said, why you really want to do the surgery? He said he told him he don't want to walk like that anymore,
My
you
God.
know. So it felt away that, oh my gosh, you're wondering if you had leave it alone, he would be here, you know.
So
And
are you blaming yourself or
I felt guilty that because of he had asked for it to be pushed back to June, I was like, oh God, he asked, he pushed back and I pushed and now he's gone. Maybe if we pushed back, I would have my son now. That's how I felt. So they were telling me, don't blame yourself. But it's kind of hard because I mean, he's not here. And then of course, yes, not to say that I really follow up a lot of negative talk, but there are persons that, yeah, I'm gonna kill off my pitney and and these are persons who don't know how him live on a daily life, right? But I can say push that aside because I too question myself that I wonder if he could have stayed with his leg, but because I got, it's not just like I run can go UA. I took
yeah,
him to 2 doctors before I went to UA. So I got more than one advice. You understand? And I too am a person who go on Google and I look at you understand, and stuff like that. So yes, it's just because he's not here and he's my company. It's been me and him. His father passed when he was young. So it's been the two of us. So now I don't have any company at home.
so it's you alone.
It's me alone,
Wow.
you know. And my relatives will say they don't want me staying by myself. But how long can you stay with them? At the end of the day, I don't sleep well at night. No matter the day, I find stuff to do. I would go on the road. Sometimes I walk around the place just to, my thoughts. But at night, no matter how far I go under, no matter what I do in the day, and I come home
Mm.
and I don't sleep, I still can't sleep at night. I still find it difficult to sleep at night. His face is the last face I see, and before I even make my eyes might close, and if I do take a look at snooze, and he's on my mind. I really don't know how I'm gonna manage.
So when is the funeral?
His funeral is for next month. Mhm.
You have the funds to bury him?
I've started making payments to the parlor, and we'll try to see if we can finish up that early next month. Yeah.
How much more you owe the funeral parlor to finish up the
They're
burial?
they're supposed to get 200,000 more.
200,000 more?
Yeah,
All
yeah.
right. So we're going to, students, we're going to help the mother to find the rest of the money to bury her son. Can we agree to that tonight, Jamaica? That we're going to find, you have somebody who can set up a GoFundMe for you?
Um, I've never done it before, but maybe I could if I have the information how to do it. Yeah.
I'm going to find somebody who can help you to set up a GoFundMe because this one linked me to the court tonight. What is his name?
Cornell Hall. I will call him later.
Cornell Hall. We're going to help you bury him. My God. How many more mothers must cry for their children? So, apart from the funeral expenses, what else is there that needs to be sorted out?
Um, I think that's the part. He has an aunt who is sending down his suit, so I guess we just have to make arrangement for that to come down for him. You know, um, I mean, if sometime person's coming to me, have you started the program yet? My
So
mind is,
so
I mean,
so who helping you cope through this?
um, the thing is, I have a cousin who is a police officer. Um, the sad part of it, Andre, that he lost his son 2 3 weeks after my son died. A little domestic incident with him and his girlfriend. And I think what I understand is that he got a wound to his chest, right? But it wasn't directly to the heart. When he went to KPH, he wasn't bleeding on the outside, it seemed like. So it would be internal bleeding. And the father said they were there talking to him, and before they realized, I guess he passed out. And it's then they realized he had internal bleeding. By the time they opened the chest, his heart, the blood was all over and it started to clot around the heart. So again, that's another thing where we look at that can delay health care. And the doctor was saying, oh, they did their best. But if someone comes to you with a wound and you're not seeing blood pouring out or running out, must be some form of internal. So he spoke to me one day and he said, have you spoken to anyone? So I said, like I spoke to pastor briefly, but he wasn't, and he said, you want to talk to anybody? I was like, okay, because I didn't have anything to do. So he took me to the chaplain and we had a little a session there. And he had at Harmon Barracks, and he has since told me that he will keep in touch with me and he'll have other sessions with me as soon as he can. But I mean, outside of that, yes, what you realize everybody else have them life to live, persons go about. My sister, if they have any time and they'll say to me, you can go on the road, they will go on the road with me because they say they don't want me alone. But it's like sometimes I just want, I don't know, it's like I'm by myself and just moving. It's like I just can't stay one place. I need to get going. This is how, yeah, I'm agitated. I find myself breathing hard and I thought like I'm out of breath. And then somebody said to me, no, you're not out of breath. That's it. That's stress because there's a tightening in my stomach. They're trying to get me to eat. That's gonna be hard.
Well, There is something called Real Helping Hands. Real Helping Hands. It's a Jamaican app similar to a GoFundMe. So they're reaching out for Caribbean people.
Hmm.
So they're reaching out to say to use their app so
Okay.
that they can sort out the thing for you. Oh Lord. Because through you're in Jamaica, it's easier. Jamaica, this one is depressing.
He's my only child, my only child, and then and I said to somebody, if I had another child, probably wouldn't take that child to the doctor because I'd be so scared if that child takes one step, I'll take two. So that's my company. My company is gone basically.
No, we have to find you some support. We have to find you some support tonight. Are you eating?
I eat a little, not much. I got my dinner and all I did was probably 2 spoons out of it. But I will get hungry, and by the time I see the food, I don't have any appetite. So yeah.
All right, so we're going to students on Saturday night coming. We're going to sort the marathon for Kenisha. Mm. Jamaica on Saturday night. We're going to do the marathon for Kenisha. This one really, this one Jamaica. And if there's any grief counselor out there if there's any grief counselor out there who, I don't know him, I don't know your son, people want to send you now. Kenisha, do you have a local bank account?
Yes, I do.
Um, Students, let us do this the organized way. Send me send me your bank account. Admin, Auntie Claudette and Cocktail, how do we do this? How do we organize the students? Because if we do this the right and organized way, let us do the marathon on send me your bank account details. No,
Okay.
no, students, I'm led to say let us do this on Saturday night. I'm led to do this on Saturday night. She will come back, we'll talk, and we'll let us organize this for Saturday night.